So maybe it's time to switch to the patient panel and hear a little bit from the patients as to how people are doing, what's, what the stories are. And that's what we try to do at this conference, is to bring you not just the science and, what are the drug development challenges, but also just directly hear from the patients. So with that, I am going to invite the patients who are in this session. And actually, I asked all the patients who have the lung complication and who are here to actually join us for this. And I believe, Luciana, we have all their names. You have, and we can spotlight them.
Yes. Yes.
Yeah, can we do that?
Sure,
Yeah.
Rashmi, I will spotlight them.
Yes, please do. Thank you. And as we get to that, actually, let me just quickly walk you over a few cases that we pulled together for this. And I'll just quickly do that while the parents are getting online, and then we'll just try to have a conversation. There's Jackie. Let me share my screen so that, we have Anna here. Do we have Ronnie here? Yeah.
Hi, Rashmi.
Hey. So here, yeah, this is Ronnie's story. We've put up the story so that we can focus mostly on the questions. And I think some of your doctors are also here. So, I think it's a case where the biologics were stopped, HLA positive, like many of us. And you're on ruxolitinib, yeah? Ronnie, you want to make any quick comments?
Ruxolitinib, cyclosporin, and unfortunately currently flaring and on an increased dose of steroid with methylpred pulses.
Yeah. And what was your max IL-18? I think I have it somewhere.
455,000 during MAS.
And no arthritis, correct?
Correct. Systemic only.
Yeah. The next was Alessandro. Are you here?
Yes, I'm here, Rashmi.
Hey, so your kid was older when she got this, yeah? And
yes, she got diagnosed at 10 years old. Now she's 16. And basically, as soon as she had SJIA onset in September 2015, just 1-2 months after, she got the first MIS episode. And since then, I mean, she has always had some repeated episode of MAS. And yes, I mean, she moved from one biologic to another, cyclosporin, obviously, and clearly cortisone has been with her since then. Now, on October 2018, she got, we observed clubbing. She started having cough, and ILD was diagnosed. And she had another episode of MAS. We tried also to enter a clinical trial on emapalumab. But we were not successful with the inclusion criteria. So now, since then, let me say, she went on Kineret plus cortisone, that she is now decreasing. And as of now, I mean, she's just having 5 mg of cortisone per day. So very, very with Kineret. And the last functional test on the lung disease are showing slight improvements, stability or slight improvements. We never tested IL-18 levels, but we are planning to do this next.
great. Okay, I actually, I want to come back to this. I think I see Melissa there. So Melissa, I think your story is very similar to many of ours, but there's that interesting thing where you're MAS. Do you want to describe that at least, that we quickly hear about that?
Sure. And we are actually maybe flaring again, and I have to take her to the ER here shortly. So I'm going to make mine quick.
Yes.
This disease never ends, guys. So my daughter, we were diagnosed with ILD in October 2021. And then we had an MAS episode where she had taken Bactrim, a couple of doses, and then got incredibly sick. She vomited. She got up one morning and had vomited in her crib. She was running a high fever. And so we took her in. We did not realize at the time that Bactrim was the trigger. She went into full MAS. You can see her ferritin CRP, what her IL-18 was. She got better with Gamifant, and that's where we still are today, using Gamifant. And we just happened to coincidentally, I was going through so much in the hospital. I don't remember why we stopped the Bactrim. It wasn't because anyone thought it was a trigger. It was one of those, let's switch this out for this while we're here kind of thing. So we stopped it while we were in the hospital in November. And when we restarted in December and ended up back in the hospital, we said, light bulb went off. It was the Bactrim.
Yeah.
So
yeah, actually, about Bactrim, that's the one medicine that my son has had a clear reaction to. And he started Bactrim right after he was diagnosed with ILD. And at that point, I think he started having a lot more rashes. And we never quite understood what was going on with the new rashes. We thought it was the ILD. And then somehow or the other, I had a really bad feeling about Bactrim and I stopped it. And then recently, when he started Gamifant, they said, no, you have to have this on. So he was in the hospital for receiving his first dose of Gamifant. And he was given Bactrim. And within a few hours, he had this terrible rash. Luckily, our team immediately, they consulted derm, everybody who's called in, and they diagnosed him with the Bactrim allergy. And they said he should never again have another dose of Bactrim. So, and we've identified more patients in our group who also have had a Bactrim allergy. So several of us have switched to pentamidine or another replacement. It's just important to point out that sometimes the medicines you give can also cause problems. So we try to tell people in the group now. With that, I'll actually come to, hey, Archana, are you there?
Hi, yes, Rashmi.
Hey. So, I'll mostly just talk a little bit about your story and then come to the more interesting parts, the recent parts. You were diagnosed in India, correct? When you
Yes,
guys were
yes,
in India,
right.
Yes. And he had more arthritis at the time, sounds
Yes.
like.
Right. It started with joint pain, swelling, everyday fever that will go on 106, 107, rash everywhere. Then it ended up with very harsh chicken pox, as you are saying in picture. And then pneumonia. Altogether took 9 months to get diagnosed. And then finally he was diagnosed at 21 months. And we were off biologic for first 5 years. He had severe arthritis, and somewhat it was controlled by naproxen, steroids, and methotrexate. But at that time, we were not able to get any biologics. So he was off biologic for first 5 years, and then we moved to USA, and we started Ilaris. It didn't work alone, so we added methotrexate, and then after a year he got MAS, and again he was allergic to sulfa, Bactrim, vancomycin, atoacone, and year later it was smoldering MAS, and then year later he got lungs disease, and then we got cytoxin and all available approved treatment we tried, but SJIA was somewhat under control, but his lungs were not at good shape. So right now we are on trial drug that Dr. Behran yesterday explained the case study. That was my child, and he is doing very much better with that thing.
Got it. And Archana, it's been about 8 months, yeah, since you started with this drug?
Yes, right.
And I was asking you, when we were discussing this session, what did you first start noticing and how long did it take?
So for 2 months, it was not, I can say we didn't see much improvement for first 2 months, but labs got much better after 3-4 months, and we could start winning the steroids. He has been steroid dependent for almost 12 years now. We could never win the steroids. Whenever we try to, when he reached to 2 to 3 mg, he starts flaring. So this is the first time we are at the lowest dose, and he is doing better with this.
Yeah. If anybody has any questions for Archana, this is a new drug that our community is getting to know. Feel free to ask. And I'll look in the chat.
Which is the new drug? Because I missed which is the new drug.
It
This
is IL-18 blocker, MS-825.
Thanks.
No problem.
Okay, so with that, I'll just end any side effects. There's a question, Archana.
So far, no side effects we are noticing. He had GI issues, and in fact, I am feeling that GI issues had got much better as inflammation is under control right now.
Got it. And so your GI issues, yes, I remember you talking about GI issues. You kept on and off having them, yeah? And what about the lungs? What do you think about the lungs?
I feel like lungs are also getting better because we had lots of period in between. He was getting cough, chest pressure and everything. Recently, we did not have to give him any painkillers or any extra inhalers. He is able to keep up with his friends, and his PFT and CT doesn't show any improvement, but I'll take that it's not worsening too. So we are more hopeful that, it will make even better if inflammation gets under control with this drug.
Got it. Got it. Anything else you want to share, Rachana?
No, thank you
No.
for giving me opportunity to share this.
Oh, of course, of course. We are glad you're here. We're glad you're all here. Okay, so I thought we'd just talk about a few general things that we've kind of noticed about. Maybe quickly go through and just who's on what drugs. Now, you want to start, Anna?
Oh, what drug she's on right now?
Just the immunosuppressives, not the
Not all of them. Kineret, cyclosporin, I guess steroids. She's on oral and IV steroids and IVIG.
Got it.
And Xeljanz.
And Xeljanz, yes.
Cyclosporin, ruxolitinib, and prednisolone and methylpred pulses.
Got it. Oh, and please add how the child is doing. I should have asked that.
Currently afebrile without rash, attempting at-home steroid wean, slightly improving labs.
Got it. So you had control for a while and then you kind of lost control and now you're trying to get under control again. Yeah.
Yes, she was on cyclosporin rux and an every other day tiny dose of prednisolone. She coincidentally had her flu shot, had a really benign rash for 30 days after the flu shot with normal labs. And only after a month's time did the rash start to progress a little bit more angry in color and spreading more regions of the body. And then the fever then followed, and then the labs came, after that 30-day period. So there was a long rash preceding the actual flare.
Got it. And Pauline, of course, now you are on no immunosuppressants, yeah, because you went through BMT.
But before the BMT, she was on Xeljanz, Cellcept, and prednisolone.
Got it.
Before
And,
BMT.
Got it. And Alessandro, we just heard about you. Kelly, what are you on now? And just your child has been diagnosed with ILD how long?
Just over a year now, and she's on ruxolitinib. Sorry, I'm saying it wrong, Jacopy. And she is on steroids. And she's lowering the steroids, and we'll be checking labs next month to see where we're at.
Got it. Jackie, I think we missed you the last time.
Yeah, sorry, my sound went off. I couldn't hear. So what were you looking for? A whole
Just like what drugs are you on currently and how is your kid doing?
Well, currently we are resuming. She had been on cyclosporin. Well, she had been on Kineret, a high dose of Kineret, Orencia, cyclosporin, prednisone with Solumedrol boluses. She's a kid that kind of hangs out in smoldering MAS or the subclinical MAS. And for about 8 months, disease continued to progress. We finally started measuring IL-18 at that point. That was continuing to shoot up. finally, it just kind of seemed to stop. We were actually at a second opinion with Dr. Grom when suddenly her blood levels looked better, and she seemed to settle down. But at that point, he diagnosed ILD, mostly subclinical. Over the next, she was fortunate because there had been years of trying lots of drugs before that, but over the next 3 years after that, she had been very, very stable. She'd enjoyed a lot of stability, slowly removing first, of course, the steroids because she couldn't handle those side effects. Next, cyclosporin. Next, Kineret, because she's 17. She stopped giving them to herself and didn't tell us, but luckily did it successfully, and had been on Orencia at an extended duration between infusions, up to eight weeks between them, and doing beautifully. Her IL-18 went from 126 at the highest point to, we didn't measure during fulminant MAS. We only started measuring later, and it was just that smoldering, down to, I would say, 4 months after her last Orencia dose, her IL-18 was 699, the lowest it had ever been. So we stopped.
Yeah.
And a month ago, she started to flare.
Yeah.
So she's back on Orencia, and we can't tell how she's responding yet or not. Her IL-18 immediately went up 45,000 immediately as soon as the rash started.
Yeah. But Jackie is one of those patients in our group who did successfully stop the biologics, and it didn't do any harm. I think there's another person, and I see her in the list, Regina.
Retrospectively, we did find out she has the sensitivity. Sensitivity.
Yeah.
Retrospectively, because we didn't do it for that reason, her ILD resolved after stopping.
Yeah.
The Kineret.
I believe everybody has that HLA type. Yeah, I think maybe Alessandro, you don't know, but all of us have that HLA type. Yeah, and I'm actually curious, how many of you, like Anna, you tried to stop the biologics? Yeah, what happened?
We did. She made it almost a whole day without her Kineret shot. She had a big solumedrol slug on a Sunday night. We skipped her Monday night shot, and by Tuesday morning, she was in a flare. So she cannot do without her Kineret. So we started it right back up.
Yeah, and before that, your kid had been doing very well from a systemic perspective for like years. Yeah, which is why you dared to try to.
Right. Yeah, her systemic wise, she's okay. Her problem is her lungs. So we can generally keep the SJIA and the MAS under control. It's just the lung progression that she struggles with, and right now her labs are going kind of the wrong way right now, and we're trying to figure out if she just needs more medication. We've doubled her Kineret, or if she's having some sort of post-COVID issues, or if she's starting pulmonary hypertension. It's just, she's kind of just heading in the wrong way right now. Generally in smaller, lots of issues, but in small changes, something's just off.
Yeah. Sorry to hear that. If there's questions in the chat for the patients, I am you can ask us questions now. I think one thing we've noticed in the group is that we've actually noticed several different patterns. Like, Jackie, Regina, another patient who's in the list, but I don't see her on here. They were able to successfully stop biologics and stay on the JAK inhibitors. Many of the others have actually tried to stop biologics and had to go right back. Some immediately, like Anna, others after some time, finally had to restart it. So it's a really mixed bag. It's hard to know which way to go and what the right thing is. But we've seen the different experiences in the group.
Rashmi, can I just say that, my daughter is off biologics for the first time. She was able to come off prednisone in October, which is really exciting. She's being controlled by tofacitinib, but we're navigating blindly when it comes to lung disease. They rate her disease activity as 0 or 1, but she still has clubbing, and I don't know what's going on inside and she's always been clinically well when it comes to the lung disease, but I don't know what's going on inside until we have a CT. So, it's just being mindful that I'm saying she's doing well, but I don't really know how she's doing. So there's always that concern with lung disease in the back of my mind.
Got it. Yeah. Coming back to the fact that, like we say in the group, is that there's 3 diseases. Yeah, we are treating. the SJIA, the MAS, and the lung disease. And you have to keep all three at bay to actually make progress. I'm going to just open this up to anyone who wants to ask any questions of us as to what we are seeing in the group, what we are learning. Jackie is saying that I have often felt that an IL-18 blocker. Yes, I think, yeah, let's talk about that. Why did some of us think about that?
Honestly, looking back, and I have painstakingly logged every piece of lab work from her. Looking back, IL-18, when we started checking, is far more predictive of her disease activity than any one of the other inflammatory markers. And right now, her other inflammatory markers look okay. Her IL-18 is still 40,000. She's having rashes.
Yeah.
There's some silent fevers, headaches, muscle pain.
Yeah. Anna, what about you? What would you like to try next?
I'm excited to hear about the IL-18 drug to see if that helps. I feel like we're kind of with the lung specific issues. I don't know what other options I have for her. She's on inhalers, she's on steroids, she's on a JAK, she's on a biologic, she's on everything I can think to put her on. And so I'm wondering just, collectively what do we have coming, down after this? And it does seem like the IL-18 might be the next thing to give a try. Yeah.
And her IL-18 hangs out at what when she's
like, when she's healthy, it's like 30, 35,000. We didn't test her when she was really sick. My hospital, I have to send them out, which I know a lot of us do. So it's difficult to make the stars align to have that happen, but healthy, she's 30, 35,000.
Got it. Anyone else about any interest in what medicines you're thinking about next, if things don't come under control?
Just ask one thing. Well, two things. What are the chances that the same sensitivity will happen with an IL-18 blocker as the IL-1 and 6? Is that a similar pathway in any way? Like, would
there be a polysorbate 80 in the IL-18 blocker?
Oh, well, I think they're still uncertain if that's there or if that's contributing, but
would there be the fear of dress, basically, you're asking? Right. Do any of the doctors want to take that?
So I'll take a stab at it at least. I think if it's blocking only IL-18, there's less chance of it skewing the cytokine profile like we talked about. If it's blocking both IL-1 and IL-18, it may have the same effect as the IL-1 only blockers.
And we don't
under that hypothesis. And if if the dress hypothesis is correct, it's very hard to predict whether it would be altering antigen presentation in the same way.
And what is accessibility to the IL-18 blocker right now? I mean, it looks like my daughter at least is blocked by age and presentation. The Euler criteria, because she doesn't have arthritis.
Fabrizio, do you know that?
Is that still the case, or is there have we opened anything?
I think I have to take this, Bryce. Yeah, so there's no trial on this predominantly systemic little, if any, arthritis, lung disease, relapsing MAS patients. We are heavily thinking about this, and actually the discussion these 3 days have made me very, very convinced that this is a way, not the way, not that arrogant, a way to go, and we should test this. I don't know if there are people from Novartis, but the company is, considering individual patients for accessing this drug. We have just started a patient. I forgot your daughter's name, Archana, apologies. I'm getting too old. He's been given that drug on the same access program. And I know of at least 2 different children who are going to get it in Europe in the next few weeks. So
is that compassionate use then? Is that how that's?
I think we'll call it, different countries would use it different names. So I think compassionate use is the word, yes, they would call it. Yeah. Technically might be slightly different.
I think that's a drug that Ed Behrens used in his patient.
Yes, yeah. This is Archana's child.
Yeah, and certainly there is increasing interest from a few pharmaceutical companies to explore IL-18 inhibition in this group of patients.
The point with this drug is that you inhibit at the same time IL-1 and IL-18, and based on what Bryce told us, we still have to learn about T cell plasticity here. But at the same time, there's trying to learn from patient or learning from patient is absolutely paramount here, not only clinically, pathogenically wise.
Can you share a little bit about how you see that working as far as if I try to get that drug for my child, is it an infusion, a shot, a pill? Do we add that med and then slowly start taking others away?
This has to be agreed with your treating physicians. Wouldn't dare, and depends on the clinical baseline situation of each individual patient, how active that is. I'm sure Alexi and others can comment on this. But I can tell you it's a biweekly IV infusion, so it's inconvenient. But the sub-Q form would come.
Okay, so by the way, Jackie, I just want to point out to you that the other IL-18 inhibitor, which is by AEVI007, if I'm not wrong, from a company called Cerecor, is actually might be open for your child even now in the US. So you should definitely look into that. That trial is open, it's for adult stills. And I think given the age, your child might qualify for it, unlike for all of us. So worth looking into that.
Yeah, Rashmi, may I? Eduardo Schifrin from Switzerland. We are a small biotech company in Switzerland. We are developing an IL-18 blockers, only single blocker for IL-18 with a recombinant molecule. But we have not yet experience in this, large experience in this condition, in this entity. We are working in autoinflammatory monogenic conditions at the moment. Yeah, but this is very interesting. The whole meeting and your experiences is very interesting for us. So we of course is in our clinical development plan, but not yet there.
Okay, that's good to know that you are interested in this condition. Are there is anybody else from the other companies here too? And thank you for speaking up, Eduardo. Anything else? Otherwise, we will move on to the working sessions. Any words from the FDA? I do see Nicolay back on the list, so just checking in.
Well, thanks, Rashmi. I think at this point, this is mostly educational for us. I'm not sure that we can comment or give any recommendations other than just try to remind you of what would be the way to get the data or the evidence that a drug works. We certainly understand that for individual patients, the immediate access is critical and important. But from our standpoint, that doesn't really help us to assess the efficacy of a drug. And actually, it can compromise the conduct of a clinical study or clinical studies. And again, just to bring this point, since you're asking for our input, that's my job to tell you whether that's what you want to hear or not, is for us to approve a drug that we don't know whether it works or how it works or how well it works is not really a good outcome. Again, I'm talking about the broader patient population with this condition.
Yeah, no, we hear you. And we actually, this morning, we had a fair bit of discussion about trial designs, external controls, etc., based on the feedback that we have received from, and we really appreciate it because it's much better than going a certain direction and then having to backtrack to know that ahead of time. So,
and I couldn't attend this morning because I had conflicting meeting, and I know that there are some still outstanding questions and concerns with what we may have said, but I think we're still open to continue this discussion. Whether that would be with a larger group like now or for individual programs or in any setting, just try to help.
I wanted to know actually for as we plan this further, what is and we try to plan out some natural history study, and what is the forum for the patients to engage? Is it just meetings like this? Is it what would you recommend?
So any forum that we have patients, is certain. Any forum that allows patients to raise their voice or concerns, is certainly welcome. We have a formal patient-focused drug development program, which can be led by external groups, and they take the lead. And I can connect you with the FDA folks that can provide further guidance. But that's one forum which is more of more structured approach for us to get inputs directly from patients on specific for specific diseases. So it's called patient-focused drug development.
Got it. Understood. Anybody else have any questions for Nikolay while we have him here with us? And thank you so much for spending time with us. We truly appreciate it.
I mean, as I said, this is as important it is for us as it is for you. I mean, this is sort of incredible opportunity for us to hear from really a broad group of people, not just industry, not just from academics, but also from patients. And
yeah, what we struggle with as we've been talking about this is that we are planning this as a patient group and physicians, but we don't know where pharma will go with this, with the agents. Yeah, like that's not something we are able to have any input in as to what ultimately happens. And even this morning, actually, I'll send you the results. We did a following up on at least the SJIA diagnostic criteria. We did a poll, and that basically saying that we recognize that there are cases of SJIA without arthritis, and adult stills and SJIA are the same thing. And we'll try to have a write-up of this paper or something. But point is, we can do all this, but we don't know what happens once the trials gets designed. And we want to make sure that this patient input actually ends up impacting trials.
Again, we can certainly reference any discussions that you have when we communicate with the sponsors, and with respect to us trying to be as open and as flexible and as available for these rare disease programs. I think I can assure that this is kind of a priority for the agency and certainly for our group. We're trying to make the drug development as easy as possible, and again, try to provide feedback to sponsors who want to develop products for these rare diseases pretty much on an ongoing basis. Again, we recognize that conducting trials in these areas is extremely challenging. So again, from our standpoint, we're trying to make ourselves available and sort of leverage the expertise that we have within the agency, because there are many other divisions that deal with very much the same questions, the same challenges. And I think this is also a priority for the agency in general to help developing these products.
Yeah. Okay, thank you so much.